Good afternoon. If you're not familiar with my face, I'm Angela Morris. I am normally the Associate Director for Resources, but I am now serving in capacity as the Interim Director. It's a pleasure to meet you all and happy Women's History Month. We are very excited to welcome you to today's town hall exclusively for our women veterans. We offer a variety of services and resources focused on your health and well being. Our Women's Health Program provides comprehensive health care for women veterans of all ages. Our primary care providers specialize in women's health and collaborate closely with specialists in gynecology, obstetrics, female urology, oncology, medicine, radiology, surgery, and breast health. We host a numerous amount of events for our women veterans. So please keep an eye on our social media challenges and website for all of our upcoming opportunities. We are thrilled that you can join us today, and we look forward to supporting you on your healthcare journey. With that being said, I would like to introduce Ms. Brenda Fritz for a Women Veterans Program overview.
Thank you, Ms. Morris. My name is Brenda Fritz, and I am the Women Veteran Program Manager here at the Hines VA. And we'd like to let all of our women veterans know that Hines cares for women. We address the healthcare needs, and we ensure timely, equitable, and high-quality comprehensive healthcare for our women veterans. We provide privacy, safety, and dignity, and sensitivity to gender-specific needs. We provide the right care in the right place, and we provide high-quality preventative and clinical care. Next, please. Our program is very fortunate. We have a substantial staff. We have a medical director, a program manager. We have primary care providers trained in women's health. We have a specialized social worker on the floor, mental health specialists, and we have even a pelvic floor physical therapist. Along with our regular primary care, we offer gynecology, urogynecology, and we have a maternity care coordinator. Next. What do we do in primary care? Well, we will do health and wellness checkups, vaccines, pap smears. We have bone density and colonoscopies, to name a few. Next. Some other services that might surprise you is that we support breastfeeding. We have breastfeeding supplies and lactation support. We have telehealth appointments, rec and art therapy, and healthy cooking classes. Next. Hines offers reproductive health services. We can provide pre- and post-pregnancy health, genetic counseling, breast health, cervical and gynecological care, and perimenopause. Next. On our gynecologist services, we have pelvic and abdominal pain, menstrual irregularities, polycystic ovarian syndrome, and other abnormalities of the vulval, vaginal, and cervical areas. Next. What's happening on the horizon? Hines is very happy to announce that we've been approved to start a breast radiology program. In our radiology program, we will be doing screening mammography, diagnostic mammography, breast ultrasound, and also breast MRI. So please stay tuned for that future announcement. Next, we're going to talk about heart healthy nutrition, and we're going to have Deborah Stemokovich come forward.
Thank you, Brenda. Hi, my name is Deborah Stemokovich. I'm a clinical dietitian in outpatient women's health clinic here at Hines VA. Today, I am here to highlight the importance of heart healthy eating. Heart disease is the leading cause of death among women, surpassing even breast cancer. Heart healthy eating can significantly reduce the risk of developing heart-related conditions and can have immediate benefits like increased energy, improved mood, weight management, and better digestion. So, heart healthy eating is more than just diet. It is a lifestyle choice for a better you. The key principles, next please. The key principles of a heart healthy diet are having a diet that is balanced, including a variety of foods, a diet that's low in saturated fat, aiming to reduce intake of red meat, full-fat dairy, and fried foods, a diet that avoids trans fat, such as ultra-processed food, a diet that is high in fiber, incorporating whole grains, fruits, vegetables, and legumes, and reducing salt intake by limiting processed foods and added salts to manage your blood pressure. This balance helps manage cholesterol and blood pressure. Moreover, the recommendations are to aim at least 5 servings of fruits and vegetables, including a diet with whole grain foods, such as options like oats, brown rice, quinoa, and whole wheat, choosing healthy fats such as avocados, nuts, seeds, and olive oil, lean proteins by opting for fish, poultry, beans, and legumes, and choosing low-fat dairy options. Next, please. Conversely, foods to eat less often include sugary drinks and snacks, minimizing sodas, candies, and pastries, avoiding ultra-processed foods by reducing intake of processed meats, fast foods, and packaged snacks, limiting salt intake by avoiding prepackaged meals and highly salted snacks, and limiting alcohol to moderate levels of 1 drink per day for women. Furthermore, the following practical tips can make all the difference in your life. Next, please. Number 1, plan for heart-healthy meals. Meal planning does save time and avoids making unhealthy food choices. It's important to try to cook at home because you have a better control of ingredients and methods. Reading labels is critical to learn and to identify unhealthy ingredients on food labels. It's important to eat mindfully, focusing on your food intake and controlling your portions better. And lastly, stay hydrated, drinking enough water to support overall health. Next. So how can a dietitian help achieve your heart health goals? Well, we have registered dietitians here at Heinz VA, and they can provide personalized, evidence-based nutrition guidance, support, and resources. We have a Heart Healthy video class that is on the first Wednesday of the month from 11 a.m. to 12 p.m., and it is a virtual class. We also have one-to-one counseling sessions with registered dietitians. A referral to see a registered dietitian or to get involved in the Heart Healthy class requires a referral from your PACT or CBOC provider. Next, we're going to talk about cervical screening with Anne Marie McNeil.
All right, thank you, Deborah. I'm Anne Marie McNeil, PA, primary care PA in the Women's Clinic. So I'm here to talk to you about cervical cancer screening. So what is cervical cancer? This is when you get cancerous cell changes in the lower part of the uterus, which is also called the cervix. This is typically caused by abnormal changes to the cells in the cervix from HPV, which is the human papillomavirus. In 2026, there will be an estimated 13,490 new cases of invasive cervical cancer and 4,200 deaths from cervical cancer in the United States alone. The vast majority of these cases are in women who have either never been screened for cervical cancer at all or who have had abnormal screening tests without appropriate follow-up. Next slide, please. So when should you get your pap smear? We start at age 21 for everyone. These are recommended every 3 years throughout your 20s, and then every 3 to 5 years for ages 30 to 65. This may change for individuals depending on your medical health history or your previous pap results if you've had abnormal testing. So just make sure you talk to your women's health provider about when you're due for your next pap. Next slide, please. How do we prevent cervical cancer? So number 1, HPV vaccines. This is something that's recommended in everyone up to age 26, and as well as individuals 27 to 45 are eligible for vaccination. So just discuss this with your healthcare provider if you're interested in it. We are seeing declining cervical cancer rates as people are getting their HPV vaccines. So 11% per year for women aged 20 to 24. And then we anticipate, an 80% reduced risk of cervical cancer for people who are vaccinated prior to the age of 16. Also get your pap smears. So people who get their pap testing are able to be detected at the precancerous stage when there's still treatment that's available with gynecology prior to progression to cervical cancer. Also, just a friendly reminder to quit smoking. This causes lots of cancer, cervical cancer being one of them. And then next up, we have Women's History Month with Octavia Stewart and Laura Brockway.
Hi, I'm Laura Brockway. I'm Program Support for the Women's Veterans Program.
And I'm Octavia Stewart. I'm with social work in the TBI Polytrauma Program, as well as the Federal Women's Program Chair. Today we're going to talk about the Federal Women's Program, as well as Women's History Month. Heinz Federal Women's Program is a part of the Equal Employment Opportunity Program, with an emphasis on the particular concerns of women of all ethnicities and advancement opportunities in the federal sector. The program provides resources to create policies and advice on issues directed toward today's women. Next slide. Women's History Month began in the U.S. as a local Women's History Week in Santa Rosa, California in 1978. Following its success, Congress passed a resolution in 1987 officially designating the entire month of March as Women's History Month to recognize women's contributions. Also in March is the International Women's Day. The first time it was honored was on March 19, 1911, in Austria, Denmark, Germany, and Switzerland, following a proposal by Clara Zetkin at the 1910 International Conference of Working Women. Over 1 million people rallied for women's rights to work, vote, receive training, and end discrimination. The day moved to March 8th in 1914, which is why we celebrate it every year on March 8th.
For Women's History Month, the Federal Women's Program, in collaboration with the Heinz Federal Women's Program, in collaboration with the Heinz Women's Veterans Program, held an event to celebrate women, and the theme was Leading the Change, Women Shaping a Sustainable Future. And we also did for International Women's History Day, and the theme was Give to Gain. We celebrated over 30 women. As you can see, we had a gallery where people were able to learn about these women who had such a huge impact. And we had trivia, we had videos where people were able to learn, and we had activities where people were able to just participate in things that celebrated these different women. Next slide, please. These are the 30 women that we celebrated. You would be able to pause your video if you wanted to learn more about them. These are all of the 30 women that we celebrated that contributed to the theme that was celebrated this year.
And also there's a significance that to the green and purple and white that we use. Those are the colors for Women's History Month and International Women's Day. That is it for us.
Up next, we're going to have Angela Morris come back up for Q&A. Thank you.
Thank you, ladies. That was very refreshing, and I did not know that about the color, so thank you for sharing. All right, so this is a time where you can certainly ask questions and receive some answers. One question that I know has been circulating around campus is how long will we have to continue masking in our outpatient and inpatient areas? We are still experiencing a bit of an uptick with our COVID activity and flu. So because of that, we are extending the issuance of masking across our campus and patient care areas. We will continue to keep everyone updated as that changes. So please, thank you in advance for your compliance to ensure the safety of yourself and your fellow veterans. All right, so I'm just going to check with the team to see if we have any questions. And it appears that we do not. Just because you don't have a question today, that doesn't mean you can't ask us at a later time. You can utilize our social media platforms to submit your inquiries. You also have any provider or employee that you encounter once you come into our facility or to the C-Box across the Chicagoland area. We have our 6 locations. So with all of that being said, feel free to continue to reach out. We will continue to post relevant information on our website and our social media platforms. And we will also continue to have our town hall as scheduled to ensure that you guys are getting the information. I'm sorry, you ladies are getting the information that you should have access to. Thank you for serving our country. Thank you for being a part of our mission. And thank you for trusting in us to receive your services from us. Have a fantastic day.